Jersey is one of 29 states reporting high flu activity. Most of this year's flu is the H3N2 strain of influenza A. Scientists discovered the strain had mutated soon after production of this year's flu vaccine began. So the vaccine may not be as effective as in previous years.
For those of you who at the moment are suffering the nasal slings and throat arrows of the flu, condolences. There is some good news about prediction on the flu, though you might not want to hear is it pretty is unusable for right now, but it will help you maybe next year. Okay? Try this. Welcome to MidPoint, Associate Professor of Environmental Health Sciences at the Mailman School of Public Health at Columbia University in New York. Jeffrey Shaman joins us today. Jeff, thanks for joining us.
My pleasure, Ed. Thanks for having me here.
Jeff, here's what caught our attention. Using math and biological science to predict flu outbreaks. I'm not a doctor, I don't play one on TV, and my math is usually pretty bad. How do you do this?
Well, you know, what we're really doing is we're borrowing techniques that have been taken and used to generate numerical weather predictions. We're using the exact same framework, but we're applying it instead to an infectious disease. In order to do it, we really just need three ingredients. We need a mathematical model that describes disease as it propagates through a population, say New York City or Seattle. We also need observations, and whether they'll have observations of temperature, they have the balloons and satellites, etc. For us, we need some sort of real-time estimate of how much flu there is in a particular locality. And the last thing we need, the third ingredient, are these statistical methods that we use to combine the two. And the idea is that if we have observations from the past all the way up to the present, we can take that model for that locality, say New York City, and we can optimize it so that it starts to replicate and really learn how to produce the flu outbreak as it has thus far transpired. And the hope is, once you get up to the present with the latest observation, that it's learned enough that when you send it into the future, it's going to make a good prediction.
Now, your 2014 predictions predicted a peak in January, I believe, correct, for 2014?
Yes.
Okay,
yes.
What do they predict for 2015?
Well, we actually do it at a variety of scales. So we do it at the national level for institutions like the CDC. And we're doing it on our website, for instance, for about 100 cities in the U.S. And so the answer is really variable depending on the location you're looking at. If you look at some place like Washington State, it's going to be much later. Oregon, for instance, it's not going to peak as it's predicting right now for another 5 weeks, 4 or 5 weeks. Some place like New York City, it's predicting it's going to peak actually next week. And places like Tennessee and Oklahoma and Arkansas, it seems that the peak probably was this week or even the past week right now.
Are the models that you're seeing, are they basically consistent, no matter how many years you've done this now, but pretty much consistent as it comes to one area and then moves and goes to the next area consistently?
No, it's actually pretty variable. Unfortunately, we have a lot of differences from year to year in flu. It often crops up in the south, but not always. Depends on the subtype. This year, as you noted, it's H3N2, this variant that's a little different from what's in the actual vaccine that was distributed. Last year, it was H1N1, and then late in the season, there was a lot of B influenza. So there's a whole myriad of patterns that takes place, and it's that irregularity that really leads us to have to try to predict it with mathematical models.
And part of the predictions, maybe the people who don't go out and get their flu shots.
Well, you know, part of the hope is that by knowing this, if you get this, for instance, on the local weather forecast, they already give you the pollen count, they already give you pollution levels. They start providing in the coming years predictions of the flu. Maybe that's going to motivate people to go out and get that vaccine.
What is the website that you're on, Jeff?
It's a little bit of a mouthful. It's called cpid.iri.columbia.edu. It's an academic website, so it's got a bit of a mouthful of a name, as I said. But if you go on there, you can see heat maps of what flu incidence looks like right now, as well as the forecast for all the cities for both the H3N2 and the B, which is floating around as well in some regions.
Well, it's also part of Columbia University Medical Center, so if people start there, at least it might be a good way for them to find it, correct?
Yeah, if you just Google it for Columbia University flu prediction, you will find it.
I think it's fascinating, and it's about time somebody did it, and maybe I'll even go out and actually get a flu shot. No, I didn't say that. By the way, did you get your flu shot this year, Jeff?
I always get a flu shot.
If you got the information, I figured you would. That would be just good.
You know, it's the best preventive medicine you can do for yourself, and it's a good public health measure as well.
There you go.
Best prevention against the flu.
Outstanding research. Jeffrey Shaman, thank you so much for joining us. We appreciate your time, and your time will continue as the third hour of MidPoint is right around the corner.